Good. Thank you, Scott. Good morning, committee. Good morning, witnesses and members of the public. We're going to spend at least the first half hour talking about paid leave. More importantly, we've heard a lot about people in this last surge of Omicron, dealing with short-term illnesses, dealing with kids in and out of school. And, the question is not being asked often enough. How are people surviving if they don't have an arrangement at work where they can't get continued pay? We've spent a lot of time in this committee dealing with the needs of businesses and how they survive during these times. But families and workers also have difficulties in surviving during these periods. I know your two groups that we have with us, Main Street Alliance and VBSR, have been have been leaders and champions in the paid family leave movement. I get the sense that paid family leave sort of has, for whatever reason, I'm not sure I agree with it, stepped aside in favor of childcare as a solution to this problem. But I think they're both needed. So with that sort of introduction, I'd leave it to you guys to make a presentation to the committee and in whatever form you would like, and whoever would like to start.
Great. Thank you so much. Jordan and I will actually be testifying kind of in tandem for today's session. So thank you for the opportunity to testify on behalf of our organizations. For the record, my name is Morgan Nichols, and I am the New England Regional Manager of Main Street Alliance, and we represent over 700 small businesses from throughout Vermont, fighting for policies that not only serve our small businesses, but our workers, our families, and our communities, because our businesses know that when our communities are doing well, our businesses can thrive.
And for the record, I'm George Giaconia, Policy Manager with Vermont Businesses for Social Responsibility, which, as you all know, we're a statewide nonprofit business association with a mission to leverage the power of businesses for positive social and environmental impact. And just to give you all sort of the latest snippet in terms of our membership breakdown, right now it's about 35% are considered small employers employing 10 full-time employees or FTEs or less. 65% employ 50 FTEs or less, and only about 6% or 40 companies or so employ 300 or more. So that's the basic breakdown, but great to be here today.
How many members do you have, Jordan?
Right now, I think we're like right around 700, maybe a little less than 700. It fluctuates quite a bit throughout the year, but I can get you the latest count once we wrap.
Great. That's great. Okay.
So we're here today on behalf of our hundreds of member businesses across the state to call on the legislature to develop a program whereby employers can be reimbursed for paying an employee's lost wages in the event of absenteeism due to COVID-19, essentially a state-based FFCRA. This initiative enjoys broad support from both of our networks, with over 100 small businesses and over 120 workers endorsing the program so far. Recently spoke to Sam Hooper at Vermont Glove in Randolph, and he said that at Vermont Glove, we have worked tirelessly to ensure that our valued employees have the ability to put health and safety first by supporting their wages when they need to be out for COVID-related reasons. This is not only the right thing to do, but it's the right business decision because it provides security and consistency for our workforce. We also know that this might not be available for all employers and workers, so we strongly support the establishment of a COVID worker relief fund so that no one needs to choose between a paycheck and their health.
And just a note for the committee here, we'll probably paraphrase a few of these quotes, but we have many more stories, as Morgan mentioned, that we collected as we collected sign-ons for this. So happy to share this with y'all once we wrap. But to continue, so the Family First Coronavirus Relief Act, just a brief refresher, offered really, really critical financial lifelines to families in need, and it required, at the time, upon initial passage, required businesses to provide that emergency paid sick leave and expanded family and medical leave for those impacted by COVID-19. But in return, the businesses received the FICROL payroll tax credits to cover the costs of providing the critical benefit. And then later, after the mandate had expired, ARPA expanded the benefits again to cover a wider range of COVID-related absences, and then also extended FICRA tax credits to businesses who voluntarily provided leave for their employees. And to put a finer point on that, it was under FCRA, it was up to 2 weeks or 80 hours of sick leave at full wage replacement for those who needed to quarantine due to COVID-19 exposure, or who were experiencing COVID-19 symptoms, up to 2 weeks of paid sick leave at 2/3 wage replacement in the event that they needed to care for someone who was in quarantine, or to care for a child in the event of a school closure or child care facility closure, for COVID-19 related reasons, or if the employee themselves was in a substantially similar condition. And then lastly, up to 10 weeks of paid expanded family and medical leave at 2/3 wage replacement for employees who had been employed for at least 30 days to care for a child whose school or child care provider was closed or unavailable for COVID-related reasons. But as you all know, unfortunately, these FCRA payroll tax credits expired back on September 30th of last year, which essentially left businesses to either pay for these existing benefits out of pocket or to eliminate them altogether. Now, Morgan and I have a lot of overlap, but this year in our membership survey, we had polled our members, to see what were the suite of benefits that they were offering. And in total, our 2020 membership survey indicated that 50% of our members now offer paid leave, which is actually about a 9% jump from 2020. But as businesses that are committed to people first workplaces and livable jobs, I think it's safe to say that the remaining half doesn't offer this benefit, not due to a lack of will, but a lack of resources, namely.
So can we jump in here with a couple of questions? First, I'm embarrassed to say, but I would expect it's fairly commonplace in the legislature that all the details you've given us about the federal program are not on the tip of our tongue, because this was all federal. It just bypassed the state altogether. We didn't really get involved. So if you could get us the background material on this for our files, your testimony essentially, that would be great. And then I guess I wanted to jump into, have any states continued the federal program when it expired in September in some form, or are other states looking to do that? States that don't have, for instance, paid family leave law. What's going on around the rest of the country? And is the frustration out there that for a lot of the vast majority of Americans, nothing's being done, and
Right.
they're just hanging out there by a thread sometimes.
Absolutely. That's a great question. And I think I can probably get you a list of what programs are being worked on across the country. What we do know is that the states that have been able to either extend their paid sick days policy or their paid family and medical leave program that already exists, they've been able to work within that infrastructure to build upon that. But for those states that don't have that infrastructure, for many of them, they haven't been able to. As far as I can tell, that's what I understand so far, is that the people that have either paid sick days like we do, but then also the paid family and medical leave solution, they've been able to build upon that, and then also kind of rope in the COVID-19 needs for use. So that's what I do understand.
And is your program that you describe, is it tied exclusively to COVID? I mean, I'm sure you guys have lobbied in the past for a broader paid medical and
Yes.
family leave program, but is what you're proposing now just to exist as long as COVID exists, and have, to the extent the surge is disappearing, have we missed this committee gets lobbied very hard by the business community to take care of their past needs that they've, either survived or haven't survived. And we have hundreds of thousands of families out there who had missed paychecks and they've survived. And we get very little in the way of requests from the people out there.
We feel that this is both sides of the same coin, right? It helps our businesses and it helps our workers. It provides support for the businesses to keep their workers who they're desperate to hold on to right now. If they can't provide this type of support to their workforce, those workers are going to go find another job because the market is so competitive right now that they're able to. So, I mean, we can continue our testimony, but we're right there with you. I mean, we genuinely believe that this would provide the support for businesses to be able to stay open, to be able to provide these jobs for their high valued employees. And it provides the necessary and critical need. I mean, the stories that I'm hearing of workers who have been out for weeks because, especially parents are getting hit from every side of the Rubik's Cube on this one, from COVID exposure, potential symptoms. They have potential COVID exposure at their work. Their businesses are closing down. I have a story that I'm happy to just lift up right now. One worker worked 11 days and 8 weeks recently. She's new to this work, and because she's the primary caregiver in her home, and because her partner earns more money, she's had to stay home from work. So just further impacting gender inequities, the trends that we see in gender inequity. I'll lift up, even within my own family, my sister has lost $2,000 between her family, between lost wages, lost sick days, paying for childcare. She hasn't been able to get because her child often has a runny nose, so has had to come home from work. I mean, that's just January. I mean, these are having incredible impacts on housing security, food security, and I cannot tell you how many parents I've had to talk to who are in pretty significant mental health crises because they're just so burned out. So we would truly feel that this is a both and. So happy
And
to
continue. And to that point, Senator, I know that it feels like a small lifetime ago that we were talking about this now. But we have some sort of basic layout of programmatic particulars in the latter end of the testimony we're happy to get into. But just to build off of Morgan's point, I think it's mostly seen as a COVID-related stopgap measure in the near term. But again, we'll kind of get to the ins and outs a little bit further along.
And there's nothing wrong with stopgap measures. It feels like we're a little late to the game on the majority of the stopgap need, but you're still convinced that there's a role going forward for something like this. We're going to still see more of these short-term takeouts of, kids having to call.
Unfortunately, yeah. I mean, and to actually, I'll even quote Senator Bowen here and using sort of, we don't want to have that we did it type moment up on the battleship as it relates to the pandemic. And I think we sort of had that to a degree, and yet we are still in a situation where businesses are really feeling the impacts. And I'd argue that now that we're in, the third year of this, the fatigue, the burnout is all the worse. And we've seen a lot of the previous assistance programs like the FICR tax credits be discontinued. So the problems remain, but the resources are slowly drying up. So just as we're continue to pursue economic recovery grants and loans, as this committee's discussed, hoping to pursue additional supports for our workforce as well.
And I'll just, before we continue, I would just lift up that for the families who, our numbers might go down, right? And that's wonderful that if we can see this trend start to go back down. But for the family who's experiencing it, even if they're the one of 5 or 20, that impact to them is crushing. So how can we create some type of program that's meeting businesses, meeting workers where they are? And I'll lift up, as part of our, kind of values associated with this, things that we would love for you to consider is especially our sole prop community. We have 60,000 sole proprietors across the state. And many of them, their bodies are how they make their work, right? They have to show up physically to be able to earn. And if they can't, I think that's another thing that we need to consider. So let's happy to continue, or
yes, let's get into some specifics. I assume it's a little bit more complicated than just say mandate that an employer give a certain amount of days for a certain reason and they get reimbursed through tax credits. So, or maybe it is that simple. Again, I don't know all the details of. Well, you started to explain the details of the federal program in terms of time off and how it would work, but you have an idea for a state follow-up program in essence?
Yeah, and the purpose of doing the overview of the FICRA, like you said, Senator, is recognize you all, as so many of us do, have so much on our plate. So we figured it was worth it to give a sort of a brief refresher, and then we'll juxtapose that compared to sort of a state like FICRA light type program. So more to come.
So Jordan, I think we've kind of covered the pitch about why this is so important. Should we just jump right into what we would urge them to consider?
Yeah, gladly.
Probably a good, and we have
away.
a full testimony, and to your point, Senator Sorokin, we actually in the original letter of support for this, we included a lot of information about FFCRA, about the federal program, including the implementation form. So there's a lot of information there. And as we shared, we put out a sign-on to our businesses and our worker community, and we've collected a lot of stories. So we'll make sure that all of that gets to you. Currently, it's 13 pages, but there's a lot of really, really good information in there for you.
Yeah, please send that.
Absolutely.
I think we did see a letter way back, but I don't know if it made it to our website, but we should get that to Scott and we'll get that posted.
Absolutely. We'll get that to you. So as you shape this program, we urge you to consider the following to ensure that this program is equitable, accessible, and that it's robust. So wage replacement. We know that wage replacement is critical for a worker's ability to actually be able to use it and to be able to afford to use it. So we want to make sure that that's commensurate with the need of everyday Vermonters. And then when we've talked to any business about this program, and I've had lots of conversations in these last few weeks, the first question that comes up is whether or not this would be retroactive. And we support looking at if there's any way for us to retroactively provide wage replacement to cover loss incurred during the height of the Omicron surge. And also, in light of the urgent need of Vermonters, we urge the legislature to implement this program upon passage or within 30 days, instead of beginning at the beginning of the new fiscal year. And then mirroring the FFCRA program, we ask that wage replacement be provided for workers who need to care for themselves or a family member, or to care for a child who has lost childcare or school due to COVID-related reasons. We feel strongly that monthly reimbursement to employers is preferable rather than quarterly reimbursement, as this puts an undue burden on both the employer and the employee. And as we consider reimbursement to cover care for a family member, we ask that we use an inclusive family definition to cover one's chosen family. We know that this is really important. And then, as I shared before, eligibility for sole proprietors. With 60,000 sole proprietors in Vermont, we know that throughout the pandemic, this group has often received delayed or has been completely left out of COVID relief. And so we must ensure that these businesses are supported. So what we do know about FFCRA here in Vermont, and there is a link to the report from August of 2021, is that 45 million came through to Vermont through the FFCRA payroll tax credit. And to your point, Senator Sorokin, what I would lift up is that there were only so many people who actually knew about this program. I know Jordan and I did a lot, and a lot of our partner organizations did everything that we could to try to make sure that businesses knew that this was available to them. But we also do know that for those businesses that took advantage of it, it was absolutely crucial. And another thing that we did find out recently, which is really exciting, is that the final rule from the U.S. Treasury detailing the allowable use of ARPA dollars clarifies that these said funds can be used for the purpose of creating, expanding, or funding paid sick and paid family and medical leave programs. And I've created a link that goes to that ruling as well. While we do not expect to fully fund a program that is on par with the federal credits, robust investments can and must be made to make Vermonters healthy and whole as we continue to navigate this pandemic.
Do you feel, you were around, I think, for part of our debate on paid family leave, and one of the
Right at the end.
issues that comes up in any paid family leave debate is who's going to pay for it. And some states it's the employer, some states it's the employee, some states it's 50-50. Mm-hmm. If we did this mini version of not really a paid family leave, but something like a replacement of the federal program, do you think there's any interest in your membership of if the state offered half the money, that they might pony up half the money to pay these wage replacements?
That's a great question, and we haven't asked that question. So I would be more than happy to bring our members together to ask, how and in what ways we might be able to fund this. So I don't have an answer to that question at this time.
And just
Jordan,
building off that point, Senator, recognize we have a finite amount of resources at our disposal. And again, don't at all expect us to really parallel or match the federal program. But in having these discussions, we've sort of gone over various alternatives, different paths that we could take. I would say from our end, I know you had mentioned mandatory versus voluntary benefit. I think if you made this a voluntary benefit, people are still going to it sort of comes back to if you build it, they will come. If you offer up some sort of resource, we will gladly market it to our membership, and they will assuredly take advantage of it. But in terms of, I think you've laid out one concept, which is, essentially that businesses would need to offer up part of the funding to fund this benefit. The alternatives are also to either have this benefit be enacted on a fairly quick turnaround, be retroactive, and go through a shorter time period. So rather than kick off at the start of the fiscal year, can get us through the school year into the summer months when caseloads have dropped. Or alternatively, you can offer, like we've mentioned, a lesser benefit, lesser wage replacement over a longer period of time. So I would say those are 3-4 different alternatives that we've explored. I think we're open to all of them, really, but wanted to get a sense from this committee what your thoughts are, and for the time being, we've mostly focused on demonstrating the need and really paying the businesses to get their thoughts on what their needs are.
Mm-hmm. And then I would also say that I think at this point, when we look retroactively, I think there's a lot of ways that you could come up with how you fund this program, or what the program looks like, what the actual cost is going to be. Is the retroactive need where you put 100% of wage replacement at this point, or a high rate of wage replacement? It depends on how long the program is going to last, what the duration for each of the subsets of the leave is. Unfortunately, I can't, it's really hard to say we need X amount of dollars and this is what it's going to cost and this is what the program is going to look like. And we would be very excited to continue this conversation with your committee and the legislature writ large to see if we can create something that's going to meet small businesses and our workers where they need it the most right now. So
is there research we could borrow from other states in this context, or are we starting a program from scratch, we have access to our joint fiscal office that can do some projections, but I'm just wondering if other states are working on for similar concepts, and if they have numbers that they could share.
I could reach out to our partners in our network across the country to see if they have a sense of what the projections were for this. Obviously, state size is gonna play a massive. California's conversation and Washington State's conversation is going to be very different, but we might be able to do get an analysis and look at it, based on our size. So I can see what I can find.
Senator Clarkson, I saw your hand up first.
Yeah. Thanks, Morgan and Jordan. That's what was one of my questions is, do you have a notion of what this might cost? Obviously, it depends on what we're looking at for a program to figure out what it would cost. And the federal program ended in September. So the time frame, is it for a year from September to September if we consider retroactive wage replacement? And how you keep track of that, and all that. I think what Michael and I've heard, and maybe others here, that some states have expanded and built on their current paid sick days policies. So to reinvent something out of whole cloth at this point in the pandemic, hopefully, it seems a little challenging. Whereas I think if we could figure out a way to effectively build on what we already have, and that would make the most amount of sense. Have you explored that at all yet, or?
I think we, in terms of the paid sick days policy, I think that if there was a way, currently our paid sick days policy is is paid for by the business, right? So what's the mechanism by which we get the funding to the business? So that doesn't exist in this moment. However, when we were in earlier conversations earlier this year, a couple things that we did talk about is the pass through the Department of Tax an option? They were able to get money out to businesses very efficiently. And so, is there a way for Department of Tax, ACCD, to be able to potentially implement this drawdown of money and create a monthly reimbursement and equitable, easy access? We also want to ensure that people are using it in the ways that to cover people who are actually experiencing loss, but we don't want to create an undue burden for these businesses so that they actually don't access it for their workers. But that when we had these initial conversations, we did hear that the Department of Tax might be a good option for us to investigate implementation.
Senator Brock?
I was just curious as to what extent, if any, does unemployment compensation potentially offer at least some relief for some of the situations that you encountered?
Sure. From what I'm hearing is, especially because a lot of these scenarios are one-off days, right? A child has a runny nose, parent gets called home from work. Being able to then retroactively go back and try to achieve UI for that is almost next to impossible. And they haven't been laid off from their jobs. So I think that UI has proven that that's not a acceptable use for that program. Happy to dig in further on that, but that's the way that we understand it.
Well, I'm thinking of a situation, for example, in which the employee has an exposure to COVID and needs to go and segregate themselves for a week or two, depending upon the situation, because the employer does not want someone who has been exposed to be at work. Mm-hmm. Would that be a reason to be able to get unemployment for that period of time?
I think I can answer that, Senator. We did have the Commissioner and Cameron in on this, and we'll be having them in again on it to refresh our memories. But they said, and Damien's here now, they said it's virtually impossible for several reasons for you to get employment. In that context, we changed the law, you recall, to let that happen for a year and a half or something, but that expired. But once that expired, there was no special path for situations like this where you can get unemployment. So, but we could talk about it again.
For us as to whether or not that is something that should be either returned or revised and updated for that purpose.
Yeah, and we could talk about that some more. You might be onto something that might be the simplest way, but I think we needed some special federal permission to do that the last time around, which had been given around the whole country, but I don't think that exists anymore. So anyhow, let me see what else I would like to know here. So the devil's going to be in the details here and in the administration. I think some of us on this committee have wanting to maybe it's naive, but wanting to take the position that let's be done with COVID and let's think about the future. And even in our economic recovery package, we're more focused on projects for the future than losses in 2020, So, I mean, I think there's an element of that in our thinking, plus retroactivity is just such a challenge. It might be better just to focus on not doing any more damage. But it is, maybe you can help us, or maybe Damien can help us now that I see him here. I don't know much about what's going on with the retention payments in the budget. I think it's in the budget.
They're in the, I think,
BBA.
wasn't it in the Budget Adjustment Act?
That's what I said. The BBA.
No, sorry, I thought you said.
I don't quite follow. I know it's a lot of money. It sounds a lot like the Essential Person Program. But who is that directed at helping? And is this a comparable group we're looking at here, or are they totally different? And why is that group more worthy of, what is it, 17 million? I don't know what the number is, but
It's a lot.
Damien, can you tell us what our appropriators are about to agree on?
Unfortunately, I don't know a lot more than the committee, but my understanding is that the retention payments are targeted to very specific subclasses of workers, particularly in areas around healthcare or long-term care where they're having trouble retaining workers right now. And my understanding of the money and the Budget Adjustment Act, and again, just for anyone watching, I wasn't the person who drafted this section, so I don't know all the details and I may get some of them wrong. But my understanding was that it was providing grants to employers within those sectors that they could then use and design their own program, but they would get a lump sum per employee. And then they could figure out where to target that money among their employees to encourage retention where they were having trouble retaining people, whether that was through retention bonuses or some other form of payment to those employees. So this wouldn't help. If you remember our hazard pay bill from a few years ago, a lot of the workers in that bill were not included in this bill, which was more targeted than that bill, which addressed frontline retail and healthcare and other groups of employees. And then we also sent money to municipalities for first responders and that sort of thing. So this was a much narrower sort of funding. And it's not addressing some of the issues that you might be having in manufacturing, Main Street retail establishments, hospitality industry, and so forth, where there may also be issues.
Could you get us, Damien, for like next week, just what material is out there that describes this new program? The numbers involved and who it affects. And also the retention payments are more designed to help these employers and businesses from their workers jumping ship to another job, right? It's not necessarily to say you're out sick for 2 weeks, so here's some money and that'll carry you over for you to come back, right? It's for
That's right. It's not a paid sick leave or a paid leave program. It's a retention program. So,
okay.
And yeah, again, I'll get more details for you next week. But my understanding is that the focus was not on the issue of needing to take off 10 days to quarantine, or because periodic times when your kid's school shuts down or your daycare shuts down because of a lack of staff or something like that.
Okay. So do our witnesses have more they want to leave us with, or does the committee have more questions at this point? I'm sure we're past our time. Okay, well, this is a lot of food for thought. Sometimes, the squeaky wheel gets the grease. And I think that even though you folks are representing small businesses, it seems like you've got a laser focus on the welfare of your employees. And I think we don't hear enough about the needs of workers. We spend a lot of time in this committee talking about economic recovery grants for business. And obviously there's a hope that will trickle down to the workers, but we can't always be sure of that. So
Wait.
if I don't see people right now I'm looking at, who's Allison?
Allison was just going to ask, with Damien here, I would love a boot up, just as we, if there are other states that have expanded on their, we've talked a little bit about this with Damien. And with Damien here, I'd love to just sort of run over at some point, have a boot up on our paid sick days program that we have in the state, how we might sort of reinvent it for this moment, or how we might retool it for this moment to capture the need here. I think that's what one of our options. And I just love a reminder about what our, and just talk about, might that be possible? Because
Damien's on our schedule for the next 20 minutes for precisely that reason. So perfect timing. Thank you guys for coming today. Stay tuned. We'll be looking to you for a resource if we move forward in this income replacement kind
this
of.
wage replacement is a challenge, but
Yes.
thank you for raising it up.
Thank you. I appreciate that. And we, like I shared, we put out a sign on to our workers and our small businesses. We are continuing to collect stories and collect sign-ons, and our plan is to deliver that to the legislature on Monday. So stay tuned. That's coming your way just for your consideration. And Jordan and I will finalize our testimony and get it over to you all. It will provide a lot of information about the current FFCRA program, and then be able to cite the Treasury ruling and the data about FFCRA.
That's what I was just going to end on. And you can get us the Treasury ruling. I'm sure Damien has seen it as well. You're saying specifically, if we wanted to do something along these lines, we could do it with ARPA funding.
Yes.
Right.
Okay.
Yeah, and happy to flesh out some of the alternatives, the various paths we can take forward as well. So more to come in that space, and just echoing Morgan's gratitude for the opportunity to provide testimony. And, lastly, I would just say, Senator, is, I know we talk about sort of that dichotomy between support for our businesses and support for our workers. I mean, as you all well know, I think I don't see it quite as binary with our employers anyway, usually it being largely those sort of employee first workplaces pushing for livable jobs. I think a lot of our members recognize that if you're able to provide these robust benefits that are family friendly benefits, for example, be that childcare subsidies or paid leave, it really goes a long way with employee retention and employee satisfaction. So we see this as a big opportunity, and, as always, appreciate y'all giving us some time.
We're here to continue the conversation in whatever way we can support the committee to see if we can get this across the finish line. So we appreciate your time and consideration. Thank you.
Thank you very much.
Thanks.
Take care.
Good to see you both.
Great to see you as well. Thank you.
Okay, so we're going to move on to Damien, and then we'll take a break at 10 when we're moving back into housing. So Damien, we're as Senator Clarkson said, we've got a bunch of ideas out there in terms of doing something in the form of additional help for workers who are both in the short term, still having to miss time for their own isolation or their kids' isolation or their elder parent being hospitalized. And then also in the long term, just because I think this has highlighted this whole last 2 years has highlighted more than ever the need to have a real paid family leave policy in this country. So we have a bill S65 that I think is a replication of the bill that the governor vetoed, and we're waiting. We have Mike Pichek back on the agenda late next week for more information from the administration as to what they're proposing. But it might be helpful if generally, if you know at this point of any like new information around the country in terms of these issues. I know you provided great charts for us the last time we were debating it about the dozen or so states that do something in this area. But have there been any changes? Have there been any, continuation of the federal program? Anything that you might be aware of? And if not today, maybe next week when we take it up again.
Yeah, so I haven't done an update since I sent you information on the 25th of January.
Okay.
But that being said, I think, right now, a lot of states are in a position where some of their temporary COVID leave expired. And at the federal level, we're also dealing with some expirations. But we did get there was the final Treasury rule on the use of the ARPA funds that clearly states that you can use it for a paid leave program that's COVID related. So that's kind of the key caveat here, is that the leave program, at least as you're using ARPA funds for it, needs to be COVID related. And there have been admonishments from the federal government in the past that we can't use the ARPA dollars to stand up a long-term program. So you're in a little bit of a balancing act where there is definitely, I would say, a possibility that a COVID-related program could morph into something else in the long run. But we also have to be conscious that we can't be using the ARPA dollars to stand up a bigger long-term program. Although we can get a COVID-related program going that could potentially then, with time, transition into something that's more general. One thing that other states have done, like Massachusetts, is they provided a paid leave mandate, but then used some of these federal relief funds to basically provide grants to employers to reimburse them for the cost of paying the leave. So employers were held harmless for those costs. Employees got to have paid leave, and the state used its ARPA funds to essentially say to employers, on the one hand, you have to provide leave for these COVID-related reasons. But on the other hand, here's a grant program that the state is going to provide to basically make you whole for the costs of leave, and then you can file for reimbursement on a periodic basis.
That's essentially what the federal program was, right?
It's very similar to the federal program. The federal program worked through tax credits, and the Massachusetts program, as I understand it, worked through grants. Where they set up, basically they appropriated a set amount of money into the program, and they established grants. I believe there was another state, maybe it was Maryland, that did something similar, where they said, to the extent, and they basically said the sick leave mandate is in effect as long as we have funds to pay out. So that had a little bit of uncertainty to it because it was dependent on uptake, how long the sick leave was going to be in effect. The Massachusetts program had a longer effective date, and they put money into the fund, I think, with the understanding that if there was uptake above what they had projected, they could appropriate additional funds and replenish the fund. The law in Massachusetts was extended through this coming April 1st last fall. And that required that employers provide 40 hours of COVID-related leave on top of the current Massachusetts leave requirements. So it was an additional amount that could be used for COVID-related purposes. Another program that is still in effect is Colorado has a provision in their sick leave law, and Senator Clarkson was asking about changes we could make to our sick leave law. And their provision in the sick leave law provides that in addition to the regular paid sick leave during a declared public health emergency, each employer is required to supplement the employee's paid sick leave for full-time employees with at least 80 hours, and for employees who work less than 40 hours in a week, the number of hours the employee works on average during a 14-day period, which is exactly what the federal sick leave requirement was.
That requires a state of emergency, though, right?
Yeah, it requires a declared public health emergency, and it allows it to either be a state or federal declaration. And I believe, and I would have to confirm this, but I believe there's still a federal public health emergency declared, even though it's not there's no state of emergency anymore. So I think Colorado's law is still in effect until the federal public health emergency is lifted. But yeah, that is one of the catches there, is theirs requires a declared public health emergency. So if for some reason that emergency is lifted, but employees are still going out for extended periods of time because of COVID, it wouldn't be in effect. So these are somewhat different models. Massachusetts essentially said they authorize it through a date certain. They're a full-time legislature, unlike us, so they came back in September and reauthorized it through April. Presumably it will expire in April unless we have another surge and they elect to reauthorize it again. And then with theirs, there's a fixed appropriation that goes with it to reimburse employers. In Colorado, I am not aware of money to make employers whole. It's simply an amendment to the state's paid sick leave law, which adds up to 10 additional days of paid sick leave during a public health emergency.
The question about UI, was I correct when I said that we would need federal approval to reinstitute the COVID eligibility?
Yeah, the issue that we are facing right now is early in the pandemic, because of the widespread shutdown of the economy and federal flexibility that we were granted, we were able to waive the able to work and available to work requirements, which allowed us to put in place those COVID-related reasons. Those have now been reinstated, and we no longer have that flexibility around able and available, which means that if you're sick, you're not able to work. Same thing if you're quarantining, you're not able and available to work because you can't, unless you can do your job remotely, in which case you should be continuing to work for your employer and shouldn't have a separation. And so that's the issue you run into with COVID-19. The other thing is you actually need a separation from employment. So if your employer says, sure, take some unpaid time off, it doesn't help the employee because they haven't been separated from employment. And that, an employer, it's to their disadvantage to separate the employee from employment, because then they've got that separation and they're liable for the unemployment. So, in this case, the employers, they can say, just take the time off, we'll keep your job. Or in the case of a family member who's very sick, it could be an FMLA or PFLA, job protected leave. So you're guaranteed this unpaid time off from work to care for a very sick family member, but you're not guaranteed pay unless you have accrued time off.
So just to be clear, you're saying that's the status of the law right now, but the state of Vermont couldn't change the law to fix that because that would put us in non-conformance with federal law.
Yeah, we can't change the unemployment law without a waiver from the federal government at this point on that able and available piece. And that was something that was provided early on in the pandemic. There was guidance saying you have increased flexibility.
Right.
And my understanding from talking to Cameron is that to some extent, the Federal Department of Labor even backtracked on that flexibility and asked states to revisit the able and available after the fact for individuals, and states had to fight back against that because there was, because of the great number of people who had been put on unemployment due to the flexibility, and then the federal government issued a clarification that actually backtracked a little bit on that. But and right now, if we moved away from that, we would go out of conformance with the federal requirements and potentially risk the issues that come with that in terms of administrative funding.
Okay. Well, thank you for that. I assume that we will have something in our omnibus bill to at least address this on a short-term basis, maybe with ARPA funds. And we'll be definitely working with you, Damien, on what possibilities of getting some language to draft it in a section. We just have a placeholder right now in there, but we got to put some meat on the bones to that and give the committee some various choices, including no choice. But we'll be working on that over the next week or so. And if people want to hear from anybody else next week, I think at the end of the week, we have, I know Bill Driscoll coming in, who is speaks on unemployment for the business community, as does David Mickenberg for the labor community. So we'll be getting in from the advocacy perspective a little bit on the UI issues and also the paid leave or sick leave kind of provisions.
Yeah.
So
There to this puzzle, Mr. Chair, if I may, I mean, this puzzle has both the complication of at this point in the pandemic, what do we hang it on? What we have, who pays, we have retroact, there's so many pieces to this puzzle we have to figure out. And to act swiftly in some ways, to go to Morgan's point and Jordan's earlier, it's as the pandemic shifts so quickly right now, is this something we need to act on sooner rather than later, particularly if it's not going to be retroactive? I mean, that's a hard, I think that's the hard, in some ways, the hardest piece for us. I'm not sure the landing and how quickly we need to land for it to be at all effective at this point, independent of our paid family leave ongoing program. This wage replacement now, to me, seems to be sort of time sensitive and maybe shouldn't be waiting for our omnibus bill to be finished. On the other hand, we're now only 3 weeks away from crossover, so it's not like there's a huge differentiation here.
Right. Okay, let's take a 10-minute break, or let's take a break till 10:15